markers and these things that we're looking at help us to determine, sort of the progression, but also things that we should be avoiding as we move forward in terms of some of the things that we're doing. I always say, oh, we don't care about pain. And that's jokingly. We do care about pain. And the reason is because statistically speaking, our patients care about pain. We have to mitigate pain for them to be satisfied. Because if we just completely go into and say, well, it's not about your pain, it's about XYZ, you can't lift, you can't walk, you can't do this, whatever. That's problematic because studies show that, they're not going to come out. Here's the good news is a lot of the things, as I mentioned earlier, that we do have pain mitigation effects to them. But we need to be careful because if all we do is address the pain, then we're going to miss the boat. So there's some great statistics actually showing that if there's too much emphasis on pain, once they're out of pain, they're not going to be coming back. So we really want to control it, but even more so, I want to keep the patient from getting worse and making sure that they're doing things at home. I literally just checked in with a new patient. I'll talk about a little bit more in a second. How are you doing today after yesterday's treatment? She's like, that was a lot for me. Like, that's not normal, even though I said, we didn't do a whole heck of a lot. She's like, for me, that was a lot. I'm like, actually, that's a really good point. And so she's like, I mean, no worse. I don't think any better. And I love it when people say that. I don't think. That actually is subliminal, and it tells us that there's probably something that was good. But as I responded, I'm like, absolutely, that's a really good point. I said, my goal, as I tell patients, is I want to make sure that I don't make you worse on that first visit because we're often doing, some things that can irritate and so on and so forth. Okay, so not sure what that means, but anyway. So the complete care management is we know that modalities are super good at decreasing pain, but they can do things biochemically and biomechanically that we can't do, as I just described with all those different physical agents, right? And we'll get into that a little bit more. And then brief note on contrasting, sort of a management, versus a treatment. So care versus treatment. So treatment, and this is, partly just semantics in dealing with the patient, where the treatment is more of that condition focus and